What's your goal to practice when you're done? Is it gonna be in a city, in a clinic, seeing patients all day? Or is it gonna be in a rural community where you're gonna need to be maybe an obstetrician, maybe an emergency doc, maybe a family physician in the clinic, and maybe a surgical assist all in the same day? So we're trying to train the rural family doc. Some of our residents might still end up in urban centers, but we want to train physicians who are able to do that full scope.
The kind of professional opportunities that I get here as a family doctor are not things that I would have been able to do if I returned to Ontario. I chose to stay here and I'm happy that I did. It's certainly not in bigger towns, even in smaller towns, just because they have more doctors, more specialists, and more physicians competing for those jobs. To have a practice like I do here, of just ER and hospitalists now, I don't think I could get that in a lot of places.
I'm confident to see the patient. I have all the equipment, I have a good training and a good support system to help me if I needed any. That's what I enjoy. I go inside the room trying to help the patient solving the problem or allocate other resources to the patient if I need, but also feeling supported by the faculty, the staff, and the community itself.
Being that we cover a large geographic area with our program, it helps give the residents exposure to many different styles of practice. They would do a rotation and go, wow, that was great. And we do another rotation and like, that one was great. And then you go to choose a specialty and you go, well, I don't want to be shoehorned into one spot. I want to do a lot of different things.
So this longitudinal will give you enough exposure to different things. Personally, I like women's health, I like emergency medicine, and we get enough of all of these during our 2 years residency.
Family doctors are the center of any patient's medical experience, and they're the center of, in many ways, our healthcare system. I won't say we can do it all, but we can do a lot. And I think that's the real value to patients.
Not only is it collegial, but when you get here, you almost get adopted into the family. It's nice because you're going to work hard, you're going to have some fun while you're working, but you're going to be part of the group.
The R2s are really helpful. We've had so many questions just coming in. We didn't know some things, so they were really helpful with that. Just being integrated well with everyone has been so nice.
It's worth your 2 years to go out and train somewhere where you're not familiar and in smaller environments. I think it makes you a better doctor, honestly. My advice would be pick Northwest as a program.
Choose Northwest. Yeah.